there is kind of a weird wrinkle in time right now with supply and demand of hygiene is very, very difficult to navigate right now as practice owners. It doesn't feel like there's any relief in sight. But what's your kind of view on the way things are and how we're going to navigate around it?
Yeah, it's really kind of an interesting place, isn't it, to be? I think the divide between dentists and hygienists has never been wider, and it's really unfortunate because I don't think it needs to be that way. You mentioned supply and demand, and I think certainly there's always opportunities throughout history where salaries need to be reset. I think we've lived through that, but now we actually have, in some markets, somewhat predatory providers out there that are just trying to see what they can get to the detriment of our profession and frankly to the patient and to the practices that they serve. And so we're seeing kind of an interesting trend. We're seeing this emergence of practices that are saying, forget it. I'm going to do my own hygiene. I'm not going to have hygienists at all. And there's very loud voices out there that are saying, you don't need it. You don't need a hygienist. And frankly, let's admit there's more than one way to run a practice successfully. And there's so many different practice styles and models out there. However, in my world, our experience is far and above the most successful practices are driven by a highly effective, capable hygiene team.
Agree.
And, I guess it just depends on what you're looking for. In my mind, we want to have hygiene providers that are partnering with the doctors and providing a higher level of patient care across the board. And certainly the productive capacity of the doctor will also struggle in my world if they're doing their own hygiene.
Of course.
I just don't think it's a sustainable model. And frankly, it's quite unfortunate because in our world, our I guess, company exists to empower hygienists and to elevate the standard of care we provide and give the hygienist really an unlimited earning potential with a production-based comp model that works for everybody. So I think it's an unfortunate place that we find ourselves, and it's really quite unnecessary to even be here in the first place. But I understand it, and certainly we're helping many practices work through it.
What do you think the genesis or the origin of this adversarial kind of relationship between practice owners and hygienists? Where do you think that began and why?
Well, I certainly think there's other elephants in the room that we haven't talked about. And that most commonly is insurance companies, the payer mix, the reimbursement rates are dropping. And therefore, there's a lot of pressure on dentists and practice owners to be profitable in an unsustainable or untenable environment. And so when we have hygiene wages, growing by such incredible numbers, 28% increases in the last couple of years, but our reimbursement rates are not meeting that climb. And so we've met very successful, highly successful practices that, one example, doing $10 million a year in revenue, that the doctor was making no income because of the increased costs and all of those challenges, no profit, right? So the struggle is real for many of these dentists. And I think that just builds on the animosity. And certainly there are hygienists that have found themselves in an unfortunate circumstance where they didn't feel valued or the culture was toxic, or whatever it may be, who've chosen to temp. And so I think it's, certainly not a universal situation. And when we try and identify what's going on or do a diagnostic, in my world, what I see is most of the disconnect comes from providers who are demanding more without being willing to earn it, right? And so we also see a lot of the frustration happening because we also have providers that, in our language, we talk about they're performing or working at the bottom of their license rather than the top. And if you're working at the bottom of your license, you're in a prophy mill. You look at your day sheet at the end of the day and it's exam, bite wings, prophy all day long. And in reality, there's so much more that we could provide to the practices to help fuel the growth. And I think as well, we certainly have practices out there that are asking their providers to sacrifice quality of care to get more patients through. And so, that also contributes to the relationship divide that we're seeing. And so I think, it would be lovely to be able to hit a reset button and say, okay, let's start fresh. Let's reinvent what a hygienist in today's world looks like and what they can contribute to a practice. And let's figure out how to creatively solve the profitability crunch, because there are ways to work around that and to fix that.
Yeah, indeed.